Well, sometimes it can take months to get in to see a doctor. In fact, you might even be watching this newscast from a crowded waiting room right now. The lack of healthcare professionals is the common complaint you hear in the Coastal Bend. And as part of our Where Do We Go From Here series, our Emily Hamilton takes a look at why we're seeing this shortage and the patients who are affected the most by it.
Lead local experts say the problem is more specifically a lack of mental health care professionals here in South Texas. It's draining our police and medical resources and putting public safety at risk. It's a problem community leaders fear may only get worse. The signs are all around us. You may see them every day.
It's a crisis. It's been a crisis coming for a while, and it's not even hit as hard as it will.
Our city's homeless population panhandling at intersections and sleeping under overpasses. Local healthcare experts say this is part of a nationwide epidemic. The growing number of people in need of mental health services and a declining number of people qualified to provide that help. Dr. John Lucens is the chair of the psychiatry department at the Corpus Christi Medical Center and says some of the mental health care providers in South Texas aren't even board certified.
They didn't go through the training programs, which they do a well enough job in an area of where there's a lack of providers, but it's not the best situation.
The growing number of people in need of those mental health services who go untreated is depleting law enforcement resources.
Our patrol officers are handling these situations on a daily basis. In 2017, we had approximately 4,000 calls for service that were mental health related.
In fact, for more than a decade, the Corpus Christi Police Department has been trying to manage the growing number of people in need of psychiatric help with few places to go.
We commit on average in the police department of 4 people a day. So that's about 12 to 1,300 a year.
Recently we saw, just because of this overcrowding, a patient who was psychotic attack another patient. That's what happens when you've got lack of resources and they have to crowd the ERs.
In 2007, a crisis intervention team was created by the police force in which officers undergo a 40-hour training program to learn de-escalation tactics. Currently, 81 Corpus Christi police officers are certified in this mental health course, all for the purpose of keeping the mentally unstable out of jail and instead in treatment facilities.
We cannot arrest ourselves out of this problem. I mean, we have to look at it, and we have to look at the reason why these individuals are homeless and why they're having issues, and get them the services that they need.
But that wasn't enough. In July, the department appointed a crisis intervention investigator whose sole role is to respond to mental health calls.
Because we want to get them out of the criminal justice system and back into the mental health care system where they belong, because these people are sick.
Officer Amber Buckaloo is on call at all times, waiting to intervene in potentially dangerous situations.
A lot of our people are homeless and they don't have family, they don't have friends, they don't have anybody checking up on them to see, have you taken your meds? Have you, how are you doing on your sobriety? Like, nobody's asking those questions.
Officer Buckaloo and her crisis intervention team consistently check on people they're concerned about. The team works with local shelters and substance abuse facilities to connect those people with the help they need. In some cases, Buckaloo and other officers will even drive those people to doctor's appointments and court appearances. She described just one of those people the department has helped.
He didn't know where to reach out for help, so when we reached out to help him, that changed everything.
Dr. Lucens said there are lots of reasons for this growing crisis, but one in particular stands out. More doctors are choosing to work in hospitals as opposed to private practices, causing a shortage of outpatient psychiatrists.
I know we can't absorb all those patients. So where will they go?
Another problem, there aren't enough places for people to get help for drug and alcohol abuse. That can lead to a ripple effect in the community, and your tax dollars end up funding it.
The biggest psychiatric hospital at this point, because of this crisis, is the Nueces County Jail.
A jail run by Nueces County Sheriff John Chris Hooper, who said 22% of people currently housed in the county jail are mentally ill.
And some of them might not belong in jail, even if they were involved in criminal activity. There probably should be other treatment and other process for the mentally challenged.
Typically, when someone's picked up by law enforcement officers and is deemed a danger to themselves or others, they're brought here to the Behavioral Health Wing at Spahn Memorial Hospital. But little activity here has people asking if these services will continue. A Christus Spohn spokesperson told KRIS 6 News those services will continue, but what's not yet known is where. The possibilities include staying at Spohn Memorial or relocating to another facility. But local experts can all agree the biggest solution to this crisis is figuring out how to attract the top-notch mental health professionals desperately needed in the Coastal Bend.
I think communication, recruitment, and kind of waiting and hoping. I hate to say it, but it is where we're at right now.
CCPD says since implementing its new program, they're arresting fewer of their frequent flyers and instead connecting them with the help they need.